second chance for a break that would make it okay. There's always some reason to feel not good enough, and it's hard.
In Sierra Leone, women have a 58% chance of dying of maternal causes between the ages of 15 and 49. Because of this high death rate, 43% of households live without parents, and the median age of citizens is only 19. Sierra Leone has a dependency ratio of 81.9%, and the development pyramid is visually skewed, with dramatically more children than adults. With a population structured this way, child labor is unavoidable, as is a large population of orphans. This crisis is holding Sierra Leone back from developing as a country, which is why our organization, Reducing Maternal Mortality, is seeking funding to help the people of Sierra Leone. Our vision is to see less women dying in labor, which would lead to fewer orphans and less children forced to work. It is our mission to reduce maternal mortality by improving infrastructure, educating women, and improving access to health care.
Our first step would be to improve the infrastructure in the country by building roads and other transportation-supportive infrastructure. By improving, rebuilding, or creating new infrastructure altogether, Sierra Leone citizens will be better connected overall, and women and children will have easier and safer access to health facilities, clinics, and schools. For this portion of the project, objectives include locating the major areas of interest which the infrastructure should connect, such as the locations of major cities, health facilities, and schools, as well as acquiring permits from the government in order to develop this network of roads, bridges, and other necessary infrastructure. Risks of infrastructure development include environmental impacts and the technological limitations of rural areas. Creating new roads and other infrastructure may require destruction of natural landscapes and disrupt natural habitats for both plants and animals. The use of these new roads would also lead to the presence of more people in these previously isolated areas, which could also cause major changes in the ecosystem. To address these risks, we plan to replant ecologically appropriate trees in other areas to offset our environmental impact. Developing the infrastructure will improve access to health care and other services, dramatically improving the quality of life and contributing to reducing maternal mortality in Sierra Leone.
Another way in which we want to meet our mission and vision is to educate women. In order to do this, schools that already exist need to be renovated and given more supplies, and more schools need to be built. Only 37.7% of females in Sierra Leone are literate, and only 15% of girls make it to secondary school. These uneducated and consequently unemployed women fall into the pattern of marrying early and having more children than they can economically support. However, many families cannot afford sending their child to school, so in addition to building schools in underserved areas, we will also provide a monetary incentive for families to educate their children. We will give a sum of money to families who have children with solid attendance at school. We want to emphasize the importance of educating women, so if a family has both boys and girls, they cannot receive the incentive unless their children of both genders are being educated. This way, families who depend on their children working to supplement their income will be able to afford this loss of labor. The risk factors that RMM have anticipated while creating this program are angering terrorist groups who may kidnap girls on the way to school or utilize acid attacks in order to dissuade girls from being educated. We will work to lessen this risk as we improve infrastructure, making the paths to school safer for everyone, but especially girls.
Finally, we will improve access to healthcare. This will entail training midwives and building clinics or supplying those pre-existing. In Sierra Leone, 58% of women give birth without a trained doctor or midwife. This leads to a high risk of death during and after the birthing process for both mother and child. We will educate midwives on the proper ways to provide care and recognize signs of danger for women in labor.
It has always been my dream to become a midwife because I want to help children and mothers. I don't want to see them dying. It is very heart-rending when you stand and see somebody dying and you cannot save that person.
In addition, most clinics are undersupplied, and a main reason women become infected during labor is due to unsanitary tools used by midwives. Finally, building new clinics will allow for cleaner facilities and more access to healthcare for pregnant women in rural areas. This will provide many great job opportunities, especially for women as midwives. These trained midwives will then be able to spread their knowledge to their villages, reducing the risk of maternal mortality in Sierra Leone. The biggest risk is the issue of transportation to the clinics. It is risky for women to travel many miles on unsafe roads to reach these clinics, but our improvements to the infrastructure should counteract this. A second risk is the new clinics could have a negative effect on the environment, as they split habitats, but we will be extremely careful in our site selection to minimize the environmental dangers.
Sierra Leone has the 5th worst maternal mortality rate in the world. This is extremely destructive to the success and development of the country, but with your support, we can turn this trend around. We will use the majority of our funding to build schools and health clinics and develop infrastructure. Our remaining funds will be utilized to train midwives, supply facilities, and help families afford to educate their daughters. We are confident this comprehensive solution will reduce maternal mortality in Sierra Leone, which is essential both for the nation's development and because everyone deserves a mother.